Hey everyone, good evening. Welcome to our MST webinar tonight. And our topic for this evening is going to be all about shelf exams, with a specific emphasis on how you can take the time that you're spending studying for these shelf exams and use that to optimize your success on step 1 and step 2 CK. It's great to virtually meet you all. My name's Mike Stevens. I am a second year, soon to be, crazy to think about, third year PGY3 dermatology resident. I'm thrilled to be joined tonight by Leah, who's with us.
Hi guys, I'm Leah. I guess I'm now a PGY1 vascular surgery resident, and I've been working with MST for, I guess, like 3 years now. And I'm really excited to be teaming up with Mike again. Mike and I have done webinars in the past, and we really enjoy working together, and it's kind of like a little reunion. So I'm glad you guys are here for this.
100%. And so just to give you guys a little bit of an overview of what we're going to talk about tonight, obviously this is in the context of your core clerkships. And as you may know, at the end of each of these clerkships, you're going to have a shelf exam. And so what we want to specifically address is how to study for these shelf exams and the optimization of the study time that you have. And one theme that's going to come up over the course of the evening is that these tests and step 2 in general are a little bit different from what you may have experienced on step 1 if you've already taken it, insofar as you're not really going to have a dedicated stretch of weeks on end where you can study each day, every day. It's more about trying to carve out time in your schedule in the context of the clerkship that you're on. We're going to talk a little bit about the resources that you should be devoting your time to, the nuances that separate step 2 CK from step 1. There is a little bit of overlap, but they're different tests and they warrant a different approach. And then we'll wrap up the evening with a live Q&A session at the end. And then just before we dive in, to give you guys a little bit of a context about who MST is and what we do, is we're an online tutoring company that focuses largely on one-to-one interactions with students, really at every step of the game through medical training, from pre-med, even before medical school, all the way through medical school in terms of step 1, step 2, step 3, shelf exams, residency core exams and competency exams, and then even the boards. We have a long track record of success, and really the bottom line, what it boils down to is we're a group of people who've had success on these tests, have kind of by trial and error figured out the way to navigate all of this, and kind of want to pay that forward to help other people who are currently going down this path. And so without any further ado, we can dive right in, and I'll let Leah take over and talk about maximizing your clerkship studies.
So if you guys haven't figured this out already, your free time's incredibly limited during clinical year. I mean, and there's nothing harder than getting up at, 5, 6 a.m. and working a full day. I mean, I guess Mike can tell us what's harder because he's doing that every single day. And then getting home and having to study, right? Like, that's really difficult. So your free time's already incredibly limited, and you're working maybe not harder, but just in a different way than you were in your first year and a half or 2 years of med school. And unlike step 1, there are both a ton of options for resources and not a ton of options, right? So you're either inundated with all of these resources that may work, or you have absolutely like one resource, really, like UWorld, that's proven to work, right? And in terms of, not only are there a ton of or not that many options for resources, you're sort of limited by the type of resource. For step 1, we had different videos and different kinds of videos. We had the memorization, memorang, sketchy videos. Then we had the Pathoma, Boards and Beyond, sort of lecture type videos. We had all these different audio resources. We had Golion. We had multiple different books and Anki cards. So you have all these different options for types of resources for step 1. For step 2, it's sort of like questions, go, which is really hard. And I'm hopeful that this webinar will help you guys sort of learn a few different resources that we believe works, and also why questions are so important. Sort of like step 1, you really want to prioritize these resources. They're going to help you actively learn. That's going to be a little bit easier because you're going to have step 1 under your belt. You're going to know what works for you and what doesn't work for you. All of these Q banks and flashcards should always be prioritized over passive learning. And then there are some more passive learning resources that we believe works. So things like online med ed and boards and beyond. So we'll mention those as we go on. But I think many of you are, as you're approaching step 2, you're sort of feeling like, wait, what resources do I use other than UWorld? And that's normal. It's totally normal to be like, wow, I don't really know where to go from here. So me and Mike are going to run you through some different clerkship options for studying and some step 2 options for studying.
Absolutely. And just to dovetail right off of what Leah said, I think that the front and center in every study plan that you're going to develop for, frankly, every single clerkship is UWorld, 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 UWorld. I feel like when I'm working with students, I become a little bit of a broken record and I just keep saying the same, but it's that important. You really have to spend time working through these Q banks. And back in the day, when I was a medical student so long ago, there weren't that many. There were only maybe like, I don't know, 2,000, 2,200 UWorld questions, and the bank has been growing dramatically. And so you need to make those adjustments accordingly if you're going to try to get through the entire Q bank. And so the ways that you should, just to state it up front, you really should prioritize trying to finish the Q bank at least during the course of your third year. And kind of in the spirit of our goal tonight of applying what you're doing for the shelf exams to step 2 CK and optimizing your success on that. This is exactly how to do it. If you're already having a whole entire pass of the Q bank under your belt before you start your dedicated study period for step 2, you're that much further ahead of the game. And so use the time that you are planning to study for the shelf exams, use that time in the same way that's productive for step 2 CK. In terms of how to go about navigating the UWorld, there are a lot of different strategies that exist. On some front, you have to prioritize quantity over quality. And that can be a little bit uncomfortable, and it can feel like tension trying to, moving on from a question where you feel like, I would like to spend more time with this. There's so much to unpack here. I want to know all of it. But you have 3,800 questions currently, and who knows how many more as they keep adding every day. And so you have to keep a pace, and you don't have all of the time in the world. You're stretched thin between all of your clinical responsibilities. So you need to keep a good pace. And things you can do is you can leverage flashcards or note documents to help you keep up a good pace. Some flashcard apps that we really like, Anki and Anki Web are some of the mainstays. If you know Anki and you feel comfortable, like the actual interface itself gives you a lot of functionality, a lot of different things you can do with the cards. I'm not that tech savvy. It was very challenging for me. I'm going to state up front, which is more commentary on me than it is on Anki. But the Anki web is very intuitive. It's very easy to use. And so if you're looking for kind of a gateway into it, then I would recommend this. And then Memorang is another flashcard app that we here at MST have a lot of experience with. And then there are other ones out there as well that you can look into. But again, just to state it, because it's important to state it, UWorld is front and center.
So something I sort of like to talk to students about is making sure that you remember the breakdown of step 2. And this changes constantly. So make sure you're checking on it prior to beginning your dedicated, so you know what the breakdown is. But this is really just to emphasize that internal medicine, family medicine, any medicine topic is going to it's going to compromise most of your exam, right? So up to 50% of your exam can be medicine type questions. Now, part of that is just that medicine is everything, right? Like it's literally everything. So you can cover all of the systems and all of the different bugs and all of the different drugs. But it's kind of comforting knowing that you're going to get a lot of your meat in those rotations. And a lot of us spend a good amount of time in those rotations. Another really heavy hitter is surgery. And that makes people a little bit uncomfortable because it can be up to 30% of your test, which is a lot for surgery, right? So I think paying attention during your surgery rotation and applying that to questions is something that's going to be really helpful for you guys. And in terms of the things that matter just a little bit less, and I don't know if matter less is the right way to say it, or rather just, if you're not incredible at reading fetal heart tones, or if OB wasn't really your jam and you don't do great on the shelf, it's not the end of the world for STEP, right? So only 10 to 20% of your STEP exam is going to be OBGYN. And then psychiatry, I think my emphasis on this is I think psychiatry questions on step 2 probably differ the least from step 1. It's much less management and much more drugs and side effects. Mike, would you agree? I don't know if that's
100%. Yeah. Absolutely.
And I think that also is true of the shelf exam. At least my shelf exam was very much so mechanism of action. What side effects are we worried about? What are we monitoring them for type things, as opposed to what's my next imaging method? So in terms of psychiatry, that's definitely going to differ the least out of all of these from step 1, which is nice because you could sort of already have it under your belt, right? Anything else to note on this, Mike?
I know. I mean, I agree 100%. You know, psych is very farm heavy. I think they lean into things that are very kind of cut and dry of like diagnostic criteria, 2 weeks for certain diagnoses, 6 months for certain diagnoses. And then, just to state it again, the importance of the medicine, and even some of these other specialties, a lot of times it can be things that relate to, for example, if it's a surgical question, it may be the medical management of a post-operative complication. And so there is a lot of overlap that exists between these, which just goes to drive home that, you want to focus on trying to, if you know your medicine well, it will serve you well.
Yeah, absolutely.
And so speaking of which then, and how to think about the internal medicine shelf. So our goal is, as we go through each of these slides, we're going to march through the different clerkships and kind of give you our take on how to approach the individual shelf exams. And what you're going to find is there are a lot of book series that Leah already mentioned, and you will have each individual clerkship has its own kind of like go-to resource that we've found is the most useful for preparing for that specific shelf exam. The theme that's going to come up with every single one of these, because I am a broken record, is UWorld. Is you have to focus on the UWorld, get through as much of it as possible. And for internal medicine, you really need to, because this is where a huge chunk of the questions are going to come from. You're going to have anywhere from 2 to 3 months on this rotation, but you're going to have upwards of 1,800 medicine questions to work through. And this is a busy service. You're going to be working long hours. You're going to be working, depending on what program you're in, you may be working on the weekends. And so you have to go in with the mindset that, again, focus on trying to drive home as many of the medicine questions, the medicine UWorld questions as possible. In your supplemental time, if you're able to carve out, if you're looking for a textbook and have time carved out to use that, Step Up to Medicine is a good one. It's a nice comprehensive kind of book that addresses a lot of the main things that you're going to see on the medicine shelf. It can be a little overwhelming. It's bullet point format. It's a lot of information. The way that I typically recommend to students to use this book is a little bit more of reference. And so if you identify things that you're consistently getting UWorld questions wrong in, let's say you're not great with arrhythmias, then flip to that chapter in the cardiology, flip to that section in the cardiology chapter and spend a little bit of time reading about arrhythmias. Don't read all of cardiology. Don't read the entire textbook because you don't feel comfortable with arrhythmias. Just read those sections. Online MedEd is a great lecture series online that you can access that kind of, again, I think is good for reference to target things that you don't feel comfortable with. And then the case file series is pretty good for internal medicine as well. Just quick snippets of common diagnoses and how to think through the epi, clinical presentation, diagnostic tests, and then management of these different things that are pretty high yield. Leah, anything else that you used for your internal medicine clerkship or when you're preparing for the shelf?
I know people say this, and I know it's sort of like a broken record, but your patients, like, wow, can you get so much information from them and you can learn so much. So like Mike said, if you're struggling with arrhythmias, I challenge you to pick up your arrhythmia patient next time. Pick up the AFib patient, go check their pulse and see if you can feel it or if it's thready or if you don't feel it because they're in AFib, right? So really like try to attach yourself to pathologies that you're struggling with because you're going to see them in real life and you can see them during your clerkship. And I think that's where I hands down learned the most information. So as you have that extra 20 minutes, you're like, oh, I can make it through like potentially 5 UWorld questions. Or I could go read up on this patient that I know is waiting in the ER for us who's an AFib, and I could learn a little bit more about the drugs that they've taken before and why they might be a candidate for ablation and what their drug regimen has been leading up to this point. So that would be my last. And I think that applies in internal medicine. It applies across all clerkships, but especially internal.
Absolutely, definitely.
All right, so surgery. Really, I think for this clerkship, it's really, you're just trying to keep your head above water, right? Like we're all adjusting to waking up at 3 a.m. and rounding or pre-rounding with the residents and then rounding with the chief resident and then rounding with the surgeon and then going to surgery, and it's only like 6 a.m. So my advice here is to use UWorld, obviously. If you have Dr. Pestana's surgery notes, it's really helpful. It's a tiny little pocketbook, so you can stick it in the back pocket of your scrubs or stick it in your white coat. And it, a lot of your residents are going to have you sort of camping out near your patient and texting them when they roll to the OR, or camping out near your patient's pre-op room and waiting for the attending to come by, or sort of just keeping an eye out for them while you're waiting instead of being on your phone, which you could be on your phone doing questions, and that's totally fine. But sometimes it feels funny around patients. You're like, oh, I don't want them to think that I'm just sitting here on my phone scrolling through Instagram. You have this great pocketbook, right? So like you can pull out Dr. Pestana's surgery notes, and instead of scrolling on your phone, you can read it. It's really well organized. It's a bunch of different clinical vignettes. It's, I think, probably some of the highest yield stuff. It's going to give you a lot of like the pimp questions that they're going to ask you in the OR, minus the anatomy. So they don't give you a ton of anatomy in Dr. Pestana's, but it is a lot of clinical management. Online med ed is a little bit, I think it's useful still here, but it's a little bit less useful just because it's harder to make the time for it. If you can make time for it, I do think it's worth it. And then because a lot of people struggle with the surgery shelf, I do recommend NBME practice tests to my students who are doing their surgery shelf. I recommend at least 2 if you can get them in the weekends before, just to have a baseline. In terms of supplementary resources, you've got all of your sort of normal case files, surgical recall. I loved Dave Virgilio. He's a vascular surgeon, so I was a little partial. But I really loved that book, and I actually read the entire thing. I also was a little bit, was an overachiever on my surgery rotation, obviously. But I think if you can make time for De Virgilio, if you read the Dr. Pestana's portion and then match it up to the De Virgilio case, it's really helpful. And they give you more anatomy. So if you're getting crushed, getting pimped in the OR, it might be helpful. And then I love AMBOSS. For all of my students, I recommend them getting AMBOSS for step 2. I think it's a great second Q bank. And I think, for those 20-minute like chunks of time where your patient is still waking up, so they're a little bit drowsy, and your resident says, hang out here and watch their vitals for me and text me if anything goes wrong or if anything changes, and you feel like you can be on your phone, I actually recommend doing questions on AMBOSS over UWorld when you're not 100% focused. So sort of saving UWorld for, okay, I have an hour of time, I'm gonna go somewhere quiet, I'm gonna sit down and simulate a testing environment, versus AMBOSS where you can sort of like sneak an extra 5 in on the side. Mike, I don't know if that's a controversial view or if other tutors think the same. What do you think?
No, I agree. I think that surgery, after medicine, you have so many questions that you have to get through in a period of time. And typically the duration of the surgery clerkship is pretty comparable to the medicine clerkship, but there are significantly fewer UWorld questions. I'd say as few as 1/3 of the medicine questions.
Yeah.
And so for that reason, you just have a lot more flexibility in your study plan, because your day-to-day is not nearly as dominated by the UWorld as it is on medicine. And so for that reason, I really do actually recommend the exact same thing. I think AMBOSS is an excellent second Q bank. Again, back in the day, we didn't have quite as many options, and this is great. I think that now they've really developed out the questions and the libraries, and I like it a lot as well. And so I'm 100% on board with that. And so moving into pediatrics, again, the UWorld is going to be front and center, #1 on our list. I find that the textbooks that exist for pediatrics are not, to be completely frank, don't impress me nearly as much as some of the other textbooks for the other clerkships. Some ones that do stand out a little bit are the Blueprints version. There's a BRS Pediatrics book. There is a step up to pediatrics. So you can see that there are iterations on all of these other textbooks that we've been discussing with the pediatrics flavor. I really think that the UWorld is going to be the primary way you learn for this clerkship. It's a little bit shorter. It's not typically, most programs have it about half the duration of medicine. So just keep that in mind when you're developing your study plan, that you're not going to have 3 months necessarily of pediatrics when you can do all of these things. Online med ed is again great. And then in the absence of having a go-to textbook that you're really spending a lot of time with, or frankly reading cover to cover, if you focus in on the UWorld, you'll have a lot of time. You'll finish that and you'll have a lot of time left over. And I would advocate here to really actually take a deep dive into the AMBOSS and try to get through all of the AMBOSS pediatrics questions as well. There are other resources that also exist. So Case Files has a version for every clerkship, and they're pretty good here. And then there are other clip cases that you can do as well that kind of give you just vignettes, short things that you can run through that kind of hit the high yield points in terms of diagnosis, treatment, and management. So that's kind of how this clerkship is a little bit more challenging in terms of the textbook front, but that's all the more reason to lean into the questions here. And what do you think, Leah? Anything else you recommend for pediatrics?
No, I found pediatrics to be a harder one to find. To have something in my hand and say, oh, I'm going to read this there's something about reading something cover to cover, and you really do have to step away from that for both clerkship and step 2. It's almost like we have to let go and say questions are going to guide us. I will say many of you are required to do aquifer cases. Many of you have come to love aquifer cases, right? So because you love them so much, you may be tempted to get it through them in 45 seconds. I encourage you, like begrudgingly almost, to spend some time on them because we have to do them anyway, right? And it takes almost as much time just to click. And they can teach you things and you can learn a lot from them. So if you're required to go through them, especially if your school gives you a time limit and says you have to spend X number of time on each of these, I would pay attention to them. All right. And then OBGYN. So I think out of all of the clerkships where medicine was sort of where you apply yourself to patients and you're able to learn the content really well from them, I think OB, you learn the next steps really well. So OB is sort of it's a kind of this bizarre specialty within a specialty all on its own, and it's a whole different world. So I think the terminology, the language that they use in OBGYN is completely different than any other terminology. So again, main resources, UWorld. I think Blueprints is pretty good. I remember I read Case Files during mine and not Blueprints, but I had plenty of students and plenty of colleagues who read Blueprints and enjoyed it. Online med ed I actually found to be really helpful during OB because it's very much so a next steps type thing. And he does his flow charts like to a T. So I really appreciate that. Like I mentioned, I read Case Files. Case Files will give you many of the cases you're going to see in the OB questions. Beckman is a recommendation for those of you out there who want to go into OBGYN. And again, this is an area where Mike sort of mentioned there are some areas where you aren't going to be pushed to like finish 30 UWorld a day on top of a clerkship. OB is sort of one of those areas. So if you have time, or if you want to start integrating AMBOSS in, this is another good place to do it. You really want to see a lot of these surgery and OBGYN questions that are next steps, that are like, when do I image versus when do I take them to the OR versus when are they bleeding out? Those sort of questions come with time and they come with practice and seeing 6 different versions of that question. And I think you get that by adding an AMBOSS to OB. Anything I missed, Mike?
No, no, absolutely. I found that I agree with you on the front about Beckman. I think is a little bit more
Yeah.
comprehensive, maybe harder to digest, but definitely good if you're looking into going into OB. Also agree 100% with obstetrics, especially. Just you have to go in with the mentality of kind of starting from scratch because
Yeah.
it is a whole nother realm in medicine and extremely algorithmic. So
Yes.
it's very much so if this, then do that. And there it gets very complicated with all of the iterations of things that can happen in the course of labor and delivery. And then one other resource that I found that was really useful was there is a question bank. It's this UWise question bank that's created by the American College of Obstetrics and Gynecology. And it's like another 600 or so questions, I think. But honestly, I almost can't believe I'm saying this, but I thought it was comparable in quality, if not even better than UWorld in teaching this stuff. And so I find that it's something that I often recommend to people if they have the time and the bandwidth to incorporate, but just something else to kind of keep on your radar if you're looking for another resource. So that brings us to psych. We're going to keep marching through. We're getting there. And so again, the UWorld is here, number one. The book here that is helpful is now first aid. So again, we kind of keep changing up the theme a little bit as we go, but I really like this book. I feel like they do a great job. It's something you can read cover to cover. It's not super long. Psych is another one of those clerkships where there's not that many UWorld, and so you can finish this off pretty quickly and then look into other options. And the benefit of this is kind of to the points we were bringing up earlier. Expect a lot of questions on diagnostic criteria, a lot of questions on pharmacology, and conveniently, those are the exact things that this textbook addresses. It kind of, in bullet point format, gives you the things that they commonly will try to stump you on the psych shelf. And then if I can, this is a little tangential, but if I can just give one, not warning, but maybe a tip when you're approaching this test, is you need to be very strict about applying diagnostic criteria. Count the SIGI caps. You have to count. If they don't get 5 out of the 9, it is not major depression. It just, in real life, it's obviously not that cut and dry, and human beings are complicated. But on this shelf in these vignettes, it has to meet the diagnostic criteria. If for symptoms or for time you don't, it is another diagnosis. And then other things that you can use to help you along the way. Online med ed has been a recurring theme that you can lean into if you feel like there's something you want to flesh out a little bit more. The practice tests, case files, just like we talked about. And again, if you have the time and the bandwidth, AMBOSS is great. And then one other one I want to throw on here as well, not to overwhelm you with too many resources, but there's a question book. It's a Q&A question book developed by Lang. And it's not... it's just more, it's a question bank, just in print format. Really, really high quality. It's higher level, it's more difficult than the UWorld, but I think if you're kind of looking to eke out a little bit of that like high pass into honors range, this is a great kind of textbook to kind of push you over that hump and get you that little bit of extra to really shine on the shelf. Leah, anything else that you recommend or you used on your psych clerkship?
I just want to say, don't underestimate this shelf. This is one that will get you. I think it is, psychiatry is deep, and it has some really complicated questions and some really complicated pharmacology. And like Mike was saying, if it's not 3 months, if it's 2.5 months, then there's a different diagnosis, at least question format wise. So really pay attention to those. Don't underestimate it. Some schools have a more lax psychiatry clerkship. And if you find yourself with a lot of extra time, I actually cracked open Sketchy a few times during my psychiatry clerkship when I needed to go over, the antipsychotics just one more time. I needed to separate them out again and sort of sort them. And I think a lot of places we sort of want to fall back on our step 1 resources, and that can be a bad thing because we sort of already talked about like letting go and stepping off of the edge. And here I am telling you that psychiatry might be the one place where if you find yourself like, really struggling with some of those drugs, Sketchy does a really good job of reorganizing them for you. You're probably going to play it on like 1.5 and get through it really fast and be like, wow, I forgot I knew so much, but it's helpful in terms of organizing.
Absolutely. I agree 100%. And again, don't underestimate this shelf.
Yeah.
It can be tricky. Um, All right, and so taking all of this together, just to give you guys a kind of general idea, or a summary of the things that we've talked about. Again, internal medicine. The common theme to all of these, we haven't listed it here, but UWorld is going to be front and center, AMBOSS if you're able to get to it. And then internal medicine, we talked about Step Up, OBGYN, we talked about blueprints, psych, especially this first aid for psych, Dr. Pastana's surgery notes for surgery. And then family medicine and emergency medicine, we didn't specifically address. Great things to think about for that are the case file series, again, because it just kind of gives you high yield common diagnoses, very likely to show up on your test, and how to think about them. And then neuro is another unique one that you may or may not have a specific clerkship in, but I really like the blueprint series for neuro. I'll be honest that I wasn't a huge fan in pediatrics or in OB, but in neuro, I felt like they did a pretty good job. And then, the main thing is, to Leah's point earlier, you're going to see recurring diagnoses or recurring concepts come up again and again just from your clinical experiences, and use that to learn. And so the overwhelming likelihood, if you're going to do 3 months on internal medicine, probably going to have a patient who's coming in with a pneumonia or a CHF exacerbation, and use that opportunity to learn as much as you can about the bread and butter medicine, because lo and behold, things that are common that an internist will deal with are common on the internist shelf exam. And the same for all of these. And so fetal heart rate tracings, thinking about inborn errors of metabolism for pediatrics, the neuro exam, like all of this is very high yield. So things that are constantly coming up in the course of your clinical experience, that should be a signal that this is something that's important that you need to know. Leah, what happens if someone fails a shelf?
So I think the big thing, and this is, I would reorganize these a little bit and just say, seek help is number one. So many of our schools have, academic counselors who are there for you, who are there to help advise you. Seeking help, asking friends, asking tutors, asking us, finding people to help you is really important. The last thing I would ever want anyone to do is be too embarrassed to seek help and then find themselves in the same situation in the next clerkship. So find somebody, find a study buddy, talk to your academic counselor, find a tutor. And then, there are going to be different options for each school. They're going to give you options to retake the shelf. I think taking it at the end of your third year is probably the most common retaking scenario, where you take it after you've done all your other clerkships. I know some schools offer you the option to take it earlier. I think it just depends on what sort of rotation you're in at the time and how confident you feel in your ability to pass it the second time. And then if you fail the shelf, then it's likely that your resources the first time around may not have been either the right resources or utilized to the best of your abilities. So try to reorganize your study materials, use your Q banks, lean on them really heavily, and sort of address your weaknesses. Say, did I go back and look at your UWorld, look at your breakdown of all of your different, categories, and see where you were weakest. Try to address those weaknesses. I think this happens to a lot more students than we know. I know a lot of students who go through this situation. So it's totally within your abilities to turn this around completely. And I think really doing well on these shelves and sort of figuring out how to take a shelf is going to make that short and dedicated period for step 2 a lot easier.
Absolutely. And so then just to address some things that we kind of had come up as we went along, and just have a dedicated slide on that. Again, case files is a great series that kind of helps you with a lot of, there are many iterations of this in many different specialties. And so this is a good resource if you're looking for something to supplement maybe OBGYN or peds, emergency medicine, certain areas that maybe the other textbooks might not fill in the details quite as well. And then there are other Q banks that also exist. My expectation is that between UWorld and AMBOSS, you have plenty, and you really don't need to go hunting for more questions beyond that. If you are a big questions guru and you really, really like them, pre-test is another option that you can use, but probably definitely a third line resource after UWorld and AMBOSS and some of the textbooks, frankly. So not something you should, the goal of this is not to inundate you with all of the different resources. We want to help keep this targeted. And so this is not something that that I routinely recommend or feel like you need to 100% have to do. And again, UWorld is going to be your number one priority, case files if it's relevant. But, we talked through all of the textbooks in each of the clerkships and how to think through which ones. And so there's going to be some variation. You have to approach clerkships differently because they have a different breadth of knowledge and a different way of thinking about clinical disease.
All right. And many of you and many schools in general are moving toward this approach of taking step one in or after third year. And this actually is statistically proven not to be a disadvantage. So even though it feels like a lot, step scores actually go up after third year. I think a lot of this is students gaining confidence sort of in, medicine in general and being able to talk to a patient and manage a patient and sort of understand what's going on pathology wise in a patient. But I think it means you have more time to figure out what resources work best for you, right? So you just have an extra year to sort of figure out, wait, is Anki really the best way for me to learn? Is, reading first aid or reading case files or reading these books really the best way for me to learn? And it gives you the chance, it gives you sort of the freedom to go into clerkships without knowing your step one score and without, going into a surgical rotation and saying, well, I can't do surgery because I don't have XX. I know this is sort of changing because step one is becoming pass fail, and the last sort of group of step one students who are taking it for a score is finishing up this spring, right? They're switching it over in just a few months. So it's going to shake things up quite a bit from what I understand, but for someone who's taking step one in third year, things are already getting shaken up. You already sort of have the freedom to explore clerkships without being limited by a number, which I think is really great. And you'll have all this practice working up differentials. Like, it's one thing to answer a question on AFib, having never seen a patient with AFib before, right? And then it's a whole nother thing to literally watch a cardioversion on a patient with AFib and say, oh my gosh, I get it. Like, I really get it. This person was on a beta blocker. Like, this person, they did synchronized cardioversion because they had a QRS, like things that you wouldn't normally get taking step one after not being in the clinic, you get after being in the clinic, which I think is really powerful. You may have this extra study time that you wouldn't have had in second year. And then obviously, like, we know this vignette format of reading step one questions that are like, pretty thick and pretty juicy with a lot of details is difficult. So step one and third year just gives you more time to get more familiar with answering those vignettes. I will say, I think, and Mike, I'm curious to hear your take on this. I actually think step two questions are longer than step one. I think there's so much more, and I don't know if it's because I know more or if it's actually just that they are so much juicier. What do you think?
I have, so to answer that question, yes, I think the vignettes are longer. I think the explanations are longer. And so if you already have done the step two Q bank before in the course of preparing for your clerkships, before you do step one, you're going to be like, oh, this is great.
Yeah.
Sail through this.
Yeah.
But I agree. I mean, I took step one after my clerkship year.
Oh, you did?
I loved it. I thought it was, honestly, I felt a little guilty because I feel like it's just such an advantage. And so I do not feel bad at all. Yes, you are very removed from biochemistry. Yes, you are very removed from the minutiae of basic science. So you have to go back and spend a lot of time preparing for that. But you just get so comfortable with the questions and with how to study and how to think about this stuff that there's no lag time. There's no like uptake of like figuring out, okay, here's how I'm going to approach things, because you've kind of figured it out. You've done your clerkships. Yeah. You kind of figured out that the style of the NBME and how they like to test on things, all of the kind of jitteriness that goes into like your very first NBME written exam is gone because you've done 6, 7, 8 of them by
Yeah.
this point. And so I really do. I think it's warranted that they're kind of making this change, and I feel like it's good.
Well, then why don't you, or I guess this is my slide, isn't it? I was going to say, why don't you tell us about the howevers? But there is another side of the coin, right? Without your step 1 score, it's difficult to schedule your 4th year electives, right? Or deciding what you want to apply into. If you do surgery and you're like, I want to do this, but I know I need a semi-competitive step 1 score and you don't have that yet, it can be sort of like putting your eggs in a basket that you don't know is formed yet, right? This exam fatigue, I'm actually not sure how much that actually happens. I think it's probably a lot of what you said, Mike, a lot of like, even though there's fatigue from taking exams, which I get, because at the end of 2nd year or at the end of your clinical year, you're like, my gosh, another NBME, let's do this again. But there's some value in saying another NBME, let's do this again, right? Because the anxiety is a little bit relieved from is that what you were saying?
Yeah, I mean, I agree 100. The fact is, you just feel much more comfortable approaching step 1 because you've done all of this, and on some level, if you go from step 1 straight into shelf exams to step 2, it's not that much different than doing shelf exam step 1 and then step 2. And so, either way, by the end of your medical training, you will have taken all of these tests, and so you can kind of nuance a little bit how you want to order them, but
yeah.
You got to do what you got to do.
Yeah. And I do think, like you said, your preclinical knowledge, like basic biochem, is you're not going to be, learning glycolysis while you're managing your patients in the ER. So that's going to take a little bit more time to go back. But the good news is we have a lot of resources, right? Like Sketchy has a pathology section now. We've got all of these different sort of creative resources and that are developing that make that a little bit easier, that paint those pictures a little bit easier for us. And then this last bullet point, I think is very frustrating because it's so true. A lot of us are going to go into clinic, see something happen, and then go take an NBME. We're going to be like, oh, wait, I saw this. They took this patient to the CT scanner. Let me answer that. And then the answer is actually like diagnostic peritoneal lavage, which, Mike, have you ever seen a diagnostic peritoneal lavage?
No.
Okay.
No.
So that's the answer to a lot of the surgery questions,
Right.
And they want, for someone who's had blunt trauma, that a fast exam is unequivocal and they cannot determine whether there's intra-abdominal bleeding. They want you to do a DPL on step.
That's a great point. I feel like especially those kinds of nuances and trauma, or there you'll find instances where what you're seeing isn't necessarily the board's answer for what you should do. It's not bad medicine per se. It's just not necessarily in that moment practical medicine.
Right. And so I think this last bullet point both applies for step 1 and it also applies for step 2. So keep that in the back of your head and you're going to get frustrated on questions when you answer according to what you've seen, and then the answer choice is actually different. But I think you should use it as a learning opportunity to really ingrain, like, whatever diagnostic peritoneal lavage is, I need to know that, even though I've never seen it done. And you probably won't ever. The truth is, it also might change, right? Those questions may change over time. But y'all, be flexible, be ready to explore, like, oh, clinical practice doesn't always apply to what's tested, but why? And what do I need to learn to bridge that gap? Because those of us who get frustrated with these questions and don't adapt to learning the nuances of them are not going to, you could push yourself, like Mike said earlier, to that like high honors place by learning these in-between steps.
Absolutely. And then just to state it, basic sciences, in discussing the differences between step 1 and step 2, basic sciences are going to be much less heavily emphasized on step 2 CK compared to step 1. And so the ins and outs of glycolysis and the Krebs cycle, thinking through the nitty gritty of how to form a granuloma and the cytokines that are involved in that, agar plates and certain types of media, not likely to show up on your step 2. And so that's just one thing to keep in mind. And then there is going to be a little bit of the overlap that you can use to your advantage between step 1 and step 2 is that some of the basics in terms of thinking about, again, epi, clinical features, diagnostics, treatment, those do carry forward from step 1 to step 2, because they're kind of basics about these diseases that are kind of pretty fixed and well established, and that is an area where you can have a little bit of overlap. And then just to go through quickly the step 1 resources that we typically recommend, just so you have these if you haven't taken this exam yet. Again, UWorld, and in this case, first aid. These are front and center, main 2 most important things that every single study calendar I develop for a student incorporates. There are a lot of supplemental resources out there. The ones that I've found that are the most useful, Pathoma, the sketchy videos are good. BRS and Boards and Beyond are great for, I think, reference if there, again, are specific things you want to go through. This is a big lecture series. Many hours of videos are incorporated into Boards and Beyond. And it's not realistic to try to do this in addition to many other things. And so what I, again, say is if you feel like you're struggling with arrhythmias, then you can absolutely watch those videos and get a little stronger foundation in that specific area. But you don't have to spend a week because of that one deficit alone watching all of the cardiology videos. It's a detriment to your study period. You don't have that much time. And if you're reviewing, especially if you're reviewing things you already know, or you feel like you're kind of falling asleep in the middle of the video, it's very passive. It's not going to be very effective. And so then, and those would be instances where you need to look into other resources. Leah, what do you recommend for step 2?
So I have all of my students, obviously, by UWorld. I recommend AMBOSS or another question bank. I think if your school buys a Q bank for you and you want to try it out, I am absolutely open to doing that. I don't want you guys spending any more money than you have to in terms of resources, because I know, you can get a little resource overloaded and then spend a ton of money on a bunch of resources that you don't use a lot of. So I think if any student comes to me with Kaplan or RX, I'm totally fine keeping that and using a second Q bank. Online med-ed is great. A lot of students, I recommend trying to watch it the weekend before your rotation starts, like try to get as much in as you can so that when you start your rotation, you're sort of fresh and like some idea of sort of what you're going to see while you're there. We talked about a lot of the supplementary resources like Step Up to Step 2, Master the Boards. Pistanas is a great one for your surgery clerkship, and then First Aid for Step 2 is another one. I think in terms of videos for supplemental resources, Online Med-Ed's really the only one that hits us for Step 2. I do know Boards and Beyond started recently. They opened up their Step 2 series. And I know that the videos are not necessarily as comprehensive, but I've heard really good reviews from students on them. So I'm curious to see how, the opinion sort of develops as their library becomes more comprehensive for Step 2. But overall, I've heard good things about Dr. Ryan and what he's doing with Step 2. I also, am partial and absolutely love him. So good. So in terms of timing, try to take this thing as soon as you can. It is really easy to think about postponing it. I want you guys to resist that urge, because this thing, sort of like what Mike said, you're taking all these NBMEs, you're like, boom, 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 let's do it. Ride that wave, right? Don't give yourself a ton of time after clerkships end to take this exam. I have students come to me who say things like, I only have 2 weeks of dedicated. Is that okay? I think it depends on the student. But I do think Step 2 is shocking in how much less time you have to take the exam. A lot of students are limited to a 2 to 4 week dedicated period time. And a lot of them are using their vacation for it. So don't be alarmed if your school doesn't give you, 6 to 8 weeks of dedicated time for this exam. They aren't giving you that because you've been doing this all year. You've been taking this exam, a version of it, every 6 to 8 weeks for the past year. That being said, give yourself a little bit of a break once clerkships are over, take the weekend, take a few days, relax, and then start to get ready to take this exam. And then the less time you put between the end of your clerkships and your test date, the less time you're going to need to study.
And so that to state it then, yes, you know a lot from the clerkships. You want to test that. You want to test that out. And so what we recommend is that take at least the practice tests that you have available to you for Step 2 CK are a little bit limited relative to what you have available to you for Step 1. And there are only a handful of NBMEs in contrast to the ones that exist for Step 1. And there are fewer external practice tests, if you will. The main ones that I typically recommend to people are the 2 UWorld self-assessments and then the 3 NBMEs exams that exist. It's important to certainly take at least, if you have the UWorld Q Bank and it's come with a practice test, then at least take the 2 practice tests you have with that. It's worthwhile also just to get a little bit of comfort with the NBME practice tests. If you are really looking to make a big delta between Step 1 and Step 2, you have to take this seriously. And I would say, space out, try to do all of the practice tests and space those out so that you can see a nice trend over time and you can monitor your progress as you go. What you want to avoid is going into this test completely unaware of where you stand and just kind of falling back on, well, I feel like I did pretty well on my shelf exams, I must be fine. Because, frankly, some of those shelf exams might be over a year ago. And so you need to have an idea of what's, what your fund of knowledge is. And then just to reemphasize the point that Leah brought up before about the timing of this exam and when you're going to take it, it can feel like a lot. Any one of these tests, not just Step 2, but all of them cover an unbelievable quantity of information. And the reality is that you need to have, if you're going to reschedule your test, you need to have a conversation with yourself about what that is going to look like. You need to have a very concrete plan of, I want to finish X number of questions, or I want to finish this, that, and the other before I take my exam, because I do think my score will be lower if I don't get through that. If it's motivated out of just feeling anxious about this content, I don't think I ever went into a single one of these tests feeling like, oh, today's the day, I got this down, I know what I'm doing. And it's because the reality is that'll never happen. And it's not to paint a very gray picture. It's just to communicate that the quantity of things that they could test you on is so much more than the quantity of what the human brain can handle. And your goal is to just learn as much as you possibly can. And so if you are posting great scores on your practice tests and you are making great progress through the Q Bank, if you're hitting your goal with numbers, with objective data, it's time. Like, you're ready, you can do this. But if you are tempted to push your exam back just due to a concern about your fund of knowledge, but it's going to come right after a sub-I where you're not going to have any time to study, or it's going to come after a long string of really challenging electives, honestly, if anything, that'll be a detriment to your score because you're not going to be able to study. You're just further removing yourself, the exam, from when you study this information. And so you have to play this out and figure out what you're going to do with the extra time and how much extra time you're really going to have before you pull the trigger and decide to change the test date. And the truth is that some residency programs, and I would say most residency programs, at least by rank day, are going to want to have a Step 2 CK score. And so you can't obviously postpone this too long. And especially if you're looking to show a lot of improvement relative to Step 1, I would encourage you to try to get your Step 2 CK scoring before you submit your application so that it's all communicated to the school at the same time. Leah, any thoughts about any of this? I know that's maybe a little bit of a controversial opinion, or I'm kind of driving a hard line here, but.
No, I think you're absolutely right. I also think sort of like what I said about the psych shelf earlier, don't underestimate Step 2. I had a lot of friends tell me this is an easier test. This is not as big of a deal. I found this test to be incredibly challenging. I don't want to scare you guys. But I don't know if it's the, resource, you're not really sure what resources to use. Nobody really has, there's not like the traditional UFAP outlined for us. Or if it's just that your clinical, like your knowledge is so much, you just have so much more of it and there's so much more to apply that it makes it a little bit intimidating. I do think this test is a very serious test. Of note, your scores are also going to look different, right? So your passing score is a 209, I believe, or a 210 for step 2, and your average score is a 242. That's very different than step 1, right? We were looking at a much lower average score and a much lower passing score for step 1. Now, we don't think these numbers are going to change when step 1 becomes pass fail for step 2, but still it's a challenging exam. And especially if you're looking for this big delta, this big change, if you didn't do so well on step 1 and you really want to blow step 2 out of the park, that means we're talking like above a 242, right? Which is a huge score. So with that, just don't underestimate that clinical knowledge. And Mike, if you could go to the next, I think the next slide is sort of our pump up slide. Stay positive, you guys. Despite all the scary things that we've said, I hope we've also left you with some really concrete knowledge. Some of it being that you're incredible students, you're incredible learners, and you've done so much so far. Really rely on the resources that work for you. I think we don't need to say it again, but I'm gonna do it anyway. UWorld's amazing. You know it, like use it. Use what everyone tells you works. They're gonna be tough days. Third year is really fun and it's a lot of work, and there's going to be a light at the end of the tunnel, and it's gonna be your specialty calling your name. So just take it one day at a time. Know that, you could say it's really hard for me to do questions every week. Like I come home exhausted. Well, if you do 10 questions every day, like 10, which is not that much. I tell students, if you can do 5, do 5. It will make a difference. If you feel like I can't do 20, I can't do 40, then do 5. Like one day at a time, one set of questions at a time. You're going to learn to apply the knowledge, but you're going to need to do it in a different way than step 1. You're going to need to do it in a Q bank. And then you guys know this, you've put the work in, trust your instincts. I have a lot of students who tell me like, oh, my gut was going here, but I chose this answer, or my gut was going in this direction, and then I started to overthink it. You're getting your instincts from somewhere. And it's a combination of your books, your questions, and your time with patients. So really trust them, apply them to your questions, and see what you can learn from them. Anything else, Mike, on staying positive? It's really hard. Step 2 is hard.
Clerkship year is challenging. The hours are long, and we're not saying this to paint a gray picture, to say that again, but you made it this far. You're doing incredible work. This is what it's all about: is applying the knowledge that you now have to patient care, and you can do it. Like you have what it takes. You've shown that so far, and again, just take it a day at a time. All right, so
go ahead.
Sure. So just to take a step back and kind of give you guys a little bit more about who we are and what we do. So the tutoring that we do is one-on-one, directly interfacing with students to work with them in terms of navigating all of this. And so if you're in the midst of your clerkship year, if you're nearing your dedicated study period for step 1 or step 2, if you're in the middle of that dedicated study period, just meeting one-on-one to talk through the content, the information, how to carve out the specific resources that you should be using. And then one of the things that I love about the being able to do this kind of work is kind of the dynamic that I have with the students that I have. We're regularly communicating with each other, constantly emailing about, here's how this practice test went. Here, I don't quite understand X, Y, and Z. Can you explain it? Like I always try to make sure that people know that I'm regularly available at any point, not even during sessions, but also in between to talk through things. And I think the biggest thing is just accountability. I work hard to talk through, if we're trying to get through X number of questions over this many days, then realistically we need to do that number of questions divided by that number of days per day. And when you kind of have someone in your corner kind of following along with you and kind of on your team, I find that it more than anything can be the difference for students in terms of how to approach this. There's a lot of different variations on this. If you're struggling with trying to identify the resources that you want to use, I often do planning sessions where we can do exactly this kind of thing and talk about, these are the textbooks that we found that work. Here are how to approach the questions. These are the NBMEs and the practice tests that we like. And then, as you wrap up this year and as you start looking into developing your application and planning for residency, there's a lot that goes into that as well, and a lot of experience that's been accrued by the many tutors with MST, and we're happy to help you through that as well. And so with that, we can start the Q&A. You guys have already dropped a ton of great questions into the chat. And so, Lee, if I can get your opinion on how, I don't know if you had this dynamic when you were, so again, I feel like I sound like I'm 80, but when I was a medical student, they didn't divide up the UWorld between shelf exam and discipline, and I think it's wonderful that they do that now. I would have appreciated that then. But did you have that option, or how do you recommend to students about how to navigate that?
So I didn't have that option on UWorld. So I don't want you to feel that old because I took that exam last year. Good.
I really appreciate that.
Not 80, just like 79-ish.
Right, exactly.
So I didn't have that option, which is amazing that they're changing it for you guys, because it means that they're giving you more questions. What I did have that on is AMBOSS, and what I actually found was that a lot of the questions overlapped. So it was that they sort of sorted these questions into, these are both ambulatory and internal medicine, or these are both internal medicine, CK, and family medicine, like shelf exam, which is great because there's a lot of overlap. I think the specific question says that would the goal be to complete both sections once prior to dedicated, both the shelf question, practice question, and the CK practice question portion? And my answer would be yes. You really do want to get through all of UWorld, and when we say all of UWorld, we mean all of it prior to beginning dedicated. And part of that is because we mentioned this earlier, but you have that shortened dedicated period. And so when you're faced with, what is it, like 3,500, 3,800? How many questions are there now?
3,800 now, yeah.
A lot. So when you're faced with 3,800 questions in 4 weeks, 30 days, that's a lot of questions to get through. So that alone is a huge endeavor, and you're not going to be able to do that. So some people are not going to be able to finish all of their questions just during dedicated, but you can do that in a year, right? Mm-hmm. So do it. Like if it's 5 questions a day during the weekdays that you're working until 7 p.m., it's 5 questions a day, and then you make up for it on the weekends. Figure out what works for you and stick to it. Like I want you guys doing questions every day. And I tell my students, I will be your helicopter mom. I will log into your UWorld and I will say, oh, hi, I saw you didn't get to your questions today, if you want me to. So I think find someone who's going to give you accountability, and find someone who's going to remind you to do them every day. Did that answer your question, Mike? I know it's kind of great that they're sorting it, because I know that there's also an ambulatory section, which is really good for family medicine, because right. Family medicine is really outpatient. And then, there's an ER section now, which is helpful. But again, a lot of these questions can cross over specialties really easily. A lot of the ER questions can become surgery, trauma, ABC questions, right? So sort of challenge yourself as you're going through these to make those connections, to say, oh, this might actually fall into this too.
And to that point, I think you'll see that on every shelf, that on the surgery shelf, I felt like I had some questions that were very OB, kind of the surgical management of yes. gynecologic complications from a hysterectomy. Yep. And then on my psych shelf, I had neuro questions that were tangential. So it's not as cut and dry as in a perfect world it might be. And that kind of dovetails into another question that someone had brought up. Does it help to do internal medicine questions during surgery? And so I think that's a great question. And when I did this, there were not many surgery questions out there. And you really had to, if you were going to utilize the UWorld, you had to do a lot of internal medicine. I still stand by that if you have the flexibility in your schedule. They've fleshed out the surgery UWorld a lot now, that I don't think it's 100% necessary. And if you're kind of torn between looking into amboss surgery versus doing the medicine UWorld, I think it might be worthwhile to switch over to the amboss before doing the medicine. That said, if you have the time, because it can be a long clerkship that can be upwards of three months, if you have the time, there are going to be a lot of questions on your surgery shelf that are the medical management of surgical patients. And so identifying specialties within medicine that relate to that, like gastroenterology, cardiology, pulmonology to some degree. There's going to be certain areas within the room MSK section that are very related to orthopedics. So those questions that fall under the medicine umbrella are very relevant for the surgery shelf. So the answer to your question is, does it help? Yes. Do you have to? No. If you're able to, sure. But you should not overwhelm yourself and feel like you need to do all of surgery and all of internal medicine, because that's not realistic, and you just can't. And then another question that came up, the same person, is kind of thoughts on BRS Peds. And I think we kind of quickly skimmed over this, I think, a little later in the evening, but UWorld and Amboss, I think, are going to be your biggest friends on Peds. And I know we had the blueprints up, and I maybe tangentially talked about BRS. They're not my favorite. I'm going to be completely transparent that I did not find that they were as helpful as doing more questions. Peds is just a tough one to navigate. Leah, any other thoughts about either of those questions?
I do have some sort of, I guess, concrete advice for the internal medicine question, which again is a really great question. Doing internal medicine questions during surgery is, if you can avoid using your internal, if you haven't done internal yet, save those questions on UWorld for your internal rotation and use the internal ones on Amboss. The perks of Amboss is that you can do the questions over and over and over again, and you can always, you are never limited in how many times you can do them, whereas UWorld you are. Once you do it, it's sort of done. So if you are going to do internal medicine questions during your surgery rotation, don't use your internal medicine questions on UWorld. That would be my recommendation. And then someone said, when would you suggest take step 1 and step 2 if your school makes you take them after 3rd year? Mike, since you did this, do you want to comment on it?
Honestly, I think it's so school dependent and person dependent, because there are curricula now that are a year preclinical. And then in your second year, at the beginning of your second year of medical school, you're already in the clerkships. Mine was a year and a half preclinical. So I had an extra 6 months opened up in my schedule that really afforded me a lot of flexibility. I think my understanding is most places that do step 1 after clerkship year have an abbreviated preclinical curriculum. It's kind of the underpinning of why they do it this way. Mm-hmm. And so if that's the case, then it's so highly dependent on a case-by-case basis, because it's your scenario. I would take step 1 before step 2, honestly. And that's just my opinion. I don't think that's based in data or numbers or statistics, but I found that made the most sense. And then after I took step 1, then a couple months later, I'd done a couple electives, and a couple months later I did step 2. That's just, it depends on your scenario and kind of what your timeline is. Great.
And then Fatima asked, in terms of NBMEs, how sort of to break them up leading up to your shelf. So she asked, should I do them back to back in the couple days leading up to the shelf, or space them out? Like one every other day with UWorld on the days in between. I think, so I'm Mike, I'm curious to hear your opinion on this. I'm of the mind that you want to space them out, that you would want to do, so starting, a few weeks, 2 weeks or 3 weeks before your shelf exam, do your first NBME and then give yourself a few days and then take another one. But I'm also a sort of treat yourself type studier. And so I wouldn't hammer myself in the days leading up to the shelf exam. I do think it depends on your school schedule. My school did not give us any time off for shelves. So if we had, and I know some schools give you like the week before leading up to it off, if you have that week and you can like put them in that week and do back to back to back, and you think you can take that, then I think that's a great idea. Otherwise, if you're sort of like how my school was set up, I would say give yourself a few days in between, because shelf exams are assessment tools. They're going to tell you where you stand. So I don't recommend doing them early on in the rotation because you won't have covered the material yet. That's where UWorld comes in. UWorld is your learning tool. So don't assess yourself until you feel like you have enough knowledge under your belt from learning. Mike, do you have anything to add on that?
No, I think I agree on, frankly, every single front. And that's pretty much the approach that I also adopt in how to think through the NBMEs with students.
Awesome.
Let's see if there's any. You guys are asking a lot of great questions. Let's see here. There's a question that's come up about the difficulty of step 2 compared to step 1. And the truth is it's just different. The questions that you get are more management oriented and less basic science. At the end of the day, both of these exams are graded on a curve. And so the way that they develop or they produce the 3-digit score is in relationship to how the whole collection of test takers do on each individual question. So it's not that it's more, the individual questions are just different, and then the way you're graded though is still relative to the overall population of test takers. Thank you guys so much for spending your evening with us. We hope this was helpful. Otherwise, we hope you have a great rest of the night, and want to say thanks again for joining us.
Thanks for coming, y'all. We had a good time.